Hello everyone, this is Dr. Meghna, your dentist. I have planned to introduce you to various syndromes that carry a lot of weightage in your exams, both university and competitive. Let's see a new syndrome with flowcharts and a lot of diagrams in each video. So without wasting a moment, let's get into the video. Must know syndromes in dentistry part 1. Let's now see PIERRE Robin syndrome. PIERRE Robin syndrome is a rare birth defect that occurs during fetal development. It commonly presents as a triad of symptoms: micrognathia, also called small jaw or underdeveloped jaw. The second is glossoptosis. It is the backward positioning of tongue. The third is the cleft palate. The Peary Robin syndrome is called a Peary Robin sequence because one defect leads to the other. At 7 to 11 weeks of gestation, there is underdevelopment of mandible due to some etiology. The causes will be discussed in the coming slides. As the mandible or lower jaw is underdeveloped, there is no room for the tongue. It falls back and the tongue obstructs the closure of palatal bones. Incomplete closure of palatal shelves results in a cleft in the midline. As you see in this diagram, the lower jaw is small, called micrognathia. Due to smaller jaw size, there is no space for the tongue. The tongue moves back and blocks the airway, making it difficult to breathe, mainly during sleep. This leads to obstructive sleep apnea. Notice the position of tongue. It is interfering with palate formation, and this leads to cleft palate. Let's discuss the etiology or causes. The first and most common is the mechanical theory. It states that micrognathia in Peary-Robin sequence occurs due to the obstruction to mandibular growth. This obstruction may be because of the position of baby in the womb or any other. The second cause is oligohydramnios. This decreased amniotic fluid that retards nutrient supply, which in turn affects growth of mandible. The next is the neurological maturation theory. It states that there is delay in neural maturation signals. The last is the rhombocephalic dysnuration theory. This is uncommon and is a disorder of segmentation of neural tube, which is responsible for the formation of oral cavity and face. Let's now see the symptoms of a patient with Peary-Robin sequence. As a result of cleft palate, there is difficulty in feeding. They need special nipples and special positioning in order to feed the baby properly. They also suffer from gastrointestinal reflux. They also experience breathing difficulties due to glossoptosis, which is called obstructive sleep apnea. This is the inability to breathe during sleep due to partial or complete blockage of airway by tongue. There's less oxygen that's going in, so the oxygen carrying capacity of the blood to the developing organs is affected. This interferes with development, leading to nasal deformities, hearing loss, and musculoskeletal disorders. These musculoskeletal disorders may be syndactyly, which means two or more digits are fused or webbed together. The next is polydactyly. It is more digits than normal. The next is clinodactyly. This means a finger or toe curves abnormally towards the next. The next is the hypermobility of joints. What is the treatment? How can we manage it? It involves a multidisciplinary approach. We need a pediatric otolaryngologist, craniofacial plastic surgeon, pediatric geneticist, pediatric pulmonologist. From the dental wing, we need a oromaxillofacial surgeon, an orthodontist, and a pedodontist. Let's see what mandibular distraction osteogenesis is. It's done to correct micrognathia. Surgical lengthening of the mandible is done. A cut is made on both sides and a distractor is placed. it is activated accordingly. So a gap is created and now a new bone deposition occurs. This procedure will be discussed clearly in oral surgery. I'll be making a separate video on it. Thus, Peary-Robin syndrome can come as a short answer question or very short answer question in your university exams. It also carries a good weightage for your competitive exams, NEET and all. They can frame a clinical based question. So remember that triad. That's all for now. You can post your doubts on syndromes or other topics you need me to explain in the comment section. Thank you. Have a great day.